So we do know that BDD very often presents with other disorders as well. It's actually more common than not to have at least one or more comorbid disorders. And so it's really important to tease apart what's BDD and what might be another disorder. And at the same time, BDD can be confused for other disorders. So for example, BDD and obsessive compulsive disorder could be confused because BDD does have an obsessive nature of the concerns and fairly compulsive behaviours to do with it. So really it's about examining what is the nature of the obsessive type thought. Is it appearance related? Does the person have very negative self-evaluations because of their appearance? Do their compulsive behaviours focus specifically on trying to manage their appearance concerns? So that can typically tease apart BDD versus OCD. Now, BDD can also look quite a lot like social anxiety disorder because someone with BDD is very concerned with how other people perceive them because of their appearance. They might avoid a lot of things socially because of how they're evaluated by others. And social anxiety disorder is a fear of negative evaluation more broadly. And I've had cases where people have been diagnosed with social anxiety disorder, and over time it's been revealed as they've become more comfortable with their therapist that their core concern is people are looking at me because of my nose or because of my ears, which is more of a BDD preoccupation. So really assessing if somebody is avoiding things socially, is it because of a general fear of negative evaluation, or is it specific to people are looking at my appearance, or I feel so ugly or I feel so ashamed because of my appearance that I can't go out in public. It's also really important to tease apart BDD and eating disorders. For a long time, it wasn't actually possible to diagnose BDD if somebody also met criteria for an eating disorder. And so that meant that somebody could have, for example, anorexia, but they might also have BDD about specific body image concerns over and above their anorexia, but that wasn't recognised. So that has improved over time. There is a recognition that these disorders are often comorbid, and so you should look specifically for both of them. If the body concerns are really dominated by a general concern about weight or overall body shape, that's typically more consistent with an eating disorder. If it's about specific body areas of concern, that's more of a body dysmorphic disorder concern. It's also very common to present with depression as well as BDD, and typically they can be teased apart fairly well by looking at the nature of the concerns. But a very severe BDD could appear to, the depressive symptoms maybe might dominate with that presentation as well.